They are among the first offered the COVID-19 vaccine, and yet the CDC reports many workers in long-term care facilities have declined it. So why would healthcare workers considered at high risk refuse the vaccine? Well, here's our Why Guy.
The COVID-19 vaccine has many across the country anxiously awaiting their turn. For healthcare workers at the front of the line, many face the needle with thanks.
What's so great about it is I'm feeling really hopeful still, right?
Not everyone is so eager to roll up their sleeve. Many of the people who care for the elderly and ill considered at high risk of encountering COVID-19 are hesitant. Some doctors and nurses in Georgia have indicated they may not get the vaccine for a year or more. A survey by the Kaiser Family Foundation found 29% of the healthcare workers questioned likely would not get the vaccine. Let's look at the reasons why. That Kaiser survey found that more than half of all Americans have concerns that the vaccine is too new. Despite clinical trials that found no serious side effects from the vaccine, 59% of Americans worry about just that. Dr. Shanta DeBay of Georgia State University School of Public Health says it's reasonable that the attitudes of healthcare workers would reflect those of the rest of the country.
Healthcare workers, although again they're on the front lines, they're also people. Even though they're in healthcare and basically have that knowledge, they're going to have their own trepidation.
Some healthcare workers have expressed that their jobs don't bring them in close contact with the elderly or ill, and that they're willing to let others go ahead of them in line. Dr. DeBay has a message for all Americans about the vaccine.
Safety concerns are always taken into consideration whenever vaccines are delivered.
The majority of Americans are willing and even eager for that shot in the arm.
Ooh. Jerry, thank you. And if you have more questions for Jerry Carnes, our Why Guy, send it to us on Facebook, Twitter, or email.